But today's topic is very, very sensitive, and that is breast reduction procedures in teenage girls. Hello, I'm Dr. Sheetal Londhe. I'm a board-certified plastic surgeon practicing at ZeroSize, Vimannagar, Pune. Okay, why this topic today? Now, I'll tell you. An incident happened with me last week, and then I said, no, everyone should know about breast reduction in younger age group. So this video today. Maybe 3 to 4 years back, one patient has consulted me, and last week, the same patient came for consultation. This is regarding breast reduction. When I saw her list on my tab, what appointments today, and I said, oh, I have done her surgery maybe 2 years back, 2.5 years back. Why is she coming now? When this girl came and I saw, she was not what I had seen. She's completely different. She came with nice jeans and a top. She came with her husband and she had got a bouquet for me and a packet of chocolates. And the confidence that she had, oh my. I could never forget those sparkling eyes and that smile that she had. Now, I felt really good about her. We examined her. Everything was fine. The scars were beautifully healed. Not much marks and all. And she said, ma'am, I'm very happy. I'm married to this young man and I've, got a hike in my career. She was a sports person and she said, I still play my sports now also. I said, very good. And she said, thank you. And she left and we also gave a hug and left. Then I sat down and I remembered what had happened 3 years back. This girl had come to my OPD with a big anarkali dress and big dupatta over it just to hide whatever breast size she had. And she had come with her parents. Well educated, but little bit you could make out from them only that they are of the orthodox type of hearts and all. And I said, but I'll examine you first, then I'll talk to your parents. She said, no ma'am, everything should happen in front of my parents because they're not understanding what I'm going through. And then I became quiet. I said, yes, this girl is suffering. She had everything that you can name for heavy breast. She had big grooves on the shoulder with big straps. Skin was showing all fungal type of infection or reactions to the sweat and all. Size was G+. Girl was already suffering from neck pain and back pain. She was psychologically, emotionally affected, physically. Outside whenever she was going, she was wearing a sun coat or a jacket. And then I understood that yes, more than the examination, she needs counseling. But still we examined, took all the measurements, and then I sat down with her and she said, ma'am, I have been suffering from heavy breast from my teenage. I am 21 years old now, but my parents are not ready for any procedure to reduce my breast. I said, okay, beta. And she said, I am 18 plus. I have the right to do my own surgery. I can just go and get it done. But I want my parents to understand what I'm suffering through because they are my parents. She had all the mental maturity a patient of a breast reduction should have. Then I spoke to the parents and I said, what is the issue? Why are you not allowing her? She's really suffering a lot from that. And they said, no. If we get her breast reduction done, she will not be able to breastfeed. No one will marry her. I said, okay. Now is anybody marrying her? Mother was also heavy breast. Okay. So she always had that guilt that is because of me, my daughter is having this. Then she said, ma'am, we have shown many alliances for her, but they think that she's overweight. Looking at the breast, whereas she was not overweight. Some say yes, some say no. The one who say yes, we do not like them. We don't want to compromise. This girl doesn't want to compromise because she's getting well educated. She's playing a good sports and all. So mom was little bit, 50% towards the breast reduction, but the father was completely against it. I explained to them, see, even if you get her married today and she breastfeeds tomorrow, with that G size of breast, how is the latching going to happen? How is it going to get baby get the latch and feed? Even if she expresses the milk and feeds the baby, the breast is still going to increase during her pregnancy. How is she going to have her, normal married life and all those things? Everything was explained clear words to both the parents, mother and father, with the child sitting there. And then the parents understood. The girl took a decision to undergo breast reduction surgery. There were regular follow-ups that happened. And then, as I told you, she just came 1 week back to my OPD. She's got married. Her career is shooting up. She's completely confident. Parents are also happy and everything is going well. Therefore, this topic today of breast reduction in younger age group. See, these teens are suffering, as I told you. They are not only undergoing the emotional stress of those heavy breasts. From a girl, they are becoming a woman. They're going into their adulthood. It's physical development all over that is happening. There's mental development all over that is happening. And at that time, that breast grows enormously. Then that trauma happens. Okay, should any girl who comes with a heavy breast and she's teenage and we go and get treated her? No. There are criteria. Which teenage will go for a breast reduction? Which teenage will go for a follow-up? And which teenage will not go for any treatment? So, most important criteria, the breast cup sizes should be too much for that child's height, weight and age. Breast development should be stable for the at least last 6 to 7 months and not completely breast is developed. Child should be in a mature phase mentally to understand what she's going to go through and what the recovery is going to be, what the scar is going to be, what's going to happen in future. Parents should be a part of the team. They must be the decision makers, both parent and the patient. So these are the criteria: symptoms, parent's decision, child's and the surgeon's decision, which procedure is correct for that child. Okay. Now what will happen when we do all this? The child's not only the confidence, but physical mobility will also increase. They will grow well mentally and emotionally and physically. Few important considerations when a teenage undergoes breast reduction surgery. The breast is going to still grow during her hormonal imbalances and pregnancies. Second, the potential risk for breastfeeding. And third, and very important, that the child should be mature enough, parents should be mature enough to take the recovery and scar related to breast reduction surgeries. Immediate benefits after breast reduction reduction surgery are: the child is relieved of that heaviness on the chest, so quality of life is very good. Can take part in any sports, any activities that they want to do. Not only the size is changed, but the posture of the child and the confidence is improved. All these things will be happening in the consultation. So again, I'm telling you, breast reduction surgery in teenage group is a very, very, very sensitive topic. It should be taken maturely, the decision with your surgeon, the patient and the parents. It's just not a one person's decision. You have any doubts? Come. We at ZeroSize Viman Nagar are always ready to answer your doubts, clear everything, make you explain what is right and what is wrong. So feel free to contact us at ZeroSize Viman Nagar, Pune. Breast reduction according to the age group is a very vast talk. So I have divided into two talks. This is the first talk and be tuned for the second part.